Hello friends, I am Dr. Sneha. Today, we are going to discuss an extremely important topic in physiology, the cardiac cycle. This lecture will be conducted by Dr. Shekhar Kulkarni, an eminent physician and a professor at the BJ Medical College, Pune. A very warm welcome to you, sir.
Thank you, Sneha. It's a pleasure to be here. So, how are all of you today? Good. As Sneha mentioned, the cardiac cycle is no doubt a very important topic, but it is an extremely interesting one too. Even after all these years of being in the medical field, I still find the rhythm, the precision, and the perfect synchrony of all the events occurring in a cardiac cycle extremely fascinating. The heart beats for the first time when we are just a 6-week-old fetus and continues doing so till the time of death, pumping about 200 million liters of blood in a lifetime. Not bad for a fist-sized pump, is it? Tell me, who wouldn't be interested in knowing every little thing that happens in a cardiac cycle?
Absolutely, sir.
Right. So, let me ask you a question, Sneha. This is René Laennec. Now, do you know what is he credited with inventing in 1816? Let me give you a clue. It is a must-carry accessory for every doctor and a kind of symbol for our fraternity.
I think it's the stethoscope, sir.
Yes, that is absolutely correct. Of course, a stethoscope is also used to listen to other sounds in the body, like lung, bowel, but it is most commonly used to listen to the heart sounds, right? So, shall we begin?
Yes. In today's lecture, we will be covering the following topics. The definition of the cardiac cycle, the phases of the cardiac cycle, events occurring during the cardiac cycle, and some applied aspects. These are the learning objectives of this lecture. So, could we start with the definition of the cardiac cycle?
Sure. But before we go to the official definition, let us understand what is the meaning of cardiac cycle. Right, now look at this. Beautifully pumping heart. A beautiful animation. Now, very simply put, the changes that occur in the heart during one beat are repeated in the same order in the next beat. This repetition of various changes that occur in heart from one beat to another beat is called a cardiac cycle. Now, once you understand this, the official definition becomes very easy. Sneha, do you remember what it is?
Yes, sir, I do. The sequence of changes in the pressure and the flow in the heart chambers and blood vessels in between two subsequent cardiac contractions is known as cardiac cycle.
Very good. So, tell me, Sneha, did you find it difficult to memorize the definition word to word?
Yes, sir. Not too much of a difficulty, but sometimes I miss out a detail.
Do you have all same difficulty as well? See, it is very simple. There are 3 things you need to understand. First, that it is a sequence of changes. Second, that there are pressure and volume changes. And third, they occur in the heart and blood vessels from one contraction to the next. Easy, isn't it?
Yes, sir. Now that you explained it like that, it really is. Next, we will discuss the duration of a cardiac cycle. Sir, could you please explain to us how this is calculated?
I will, but again before that, try to understand why we need to know the duration. Why do we need to know how long a cardiac cycle is? Sneha, do you know why?
Because each cardiac cycle is subdivided into various parts like systole and diastole, and they are further divided into different phases, each with a specific duration. And the duration is dependent on the duration of the whole cardiac cycle.
Very good. But why do we need to know the duration of these parts and their phases?
Because it could be asked in the exam.
Yes, that is true. But the reason it is likely to be asked in the exams is that because this knowledge has a very practical application in clinical practice. Let me explain. We all know that the heart contracts and relaxes, right? When it contracts, it pushes the blood to all the organs of the body. And when it relaxes, it gets filled with the blood. But what about the heart itself? Doesn't it need blood? Think of the heart as a cashier at the bank and the rest of the body as customers of the bank. The cashier handles a lot of money for the customers, but the cashier needs to get paid too, isn't it? In this case, the payment is oxygen supply, which the blood carries. Blood can't just be absorbed through the walls of the chambers. There are specific blood vessels called coronary arteries. They supply the heart muscles with blood. And unlike the rest of the body, the heart gets its blood supply not during the contraction, but during relaxation. We will learn about that in the coronary circulation chapter in another lecture. Now, if the heart is beating very fast, the time taken for contraction and relaxation becomes less, right?
Yes, sir.
But it is the relaxation phase of the heart that is compromised most when the heart is beating very fast. So in such a scenario, blood supply to the heart itself is compromised. And the practical implication of this is that in a diseased heart, severe tachycardia or rapid beating of the heart, which is typically seen after strenuous exercise, can lead to myocardial infarction or heart attack. So, for example, when the patient is undergoing a stress test, it is critical that his or her heart rate does not cross a certain limit, or else a diagnostic test itself could precipitate an MI or a myocardial infarction. And this is why it is important to study the duration of the cardiac cycle. So, now let us see how we calculate the duration. It is very simple. Each minute has 60 seconds, and if the heart beats 60 times a minute, you divide 60 seconds by 60 beats, and the duration becomes 1 second per cardiac cycle. But the average heart rate is slightly faster at about 75 beats per minute. So, what will be the duration of cardiac cycle?
It will be 60 divided by 75, which is 0.8 seconds.
And these 0.8 seconds are further subdivided into many smaller parts, as we will learn later. Another important thing that you must remember is that in a healthy heart, slower the heart rate, more the stroke volume, or the amount of blood that is pumped out. Athletes and other sports people have much lower heart rate than normal individuals. This is because of two reasons. One, regular exercise and training increases the vagal tone, which slows down the heart rate. And second, this causes non-pathological cardiomegaly or enlarged heart. So their heart pumps out a massive amount of blood in each cycle. Andy Murray, the English tennis player, has a resting heart rate of just 37 beats per minute. So his heart is pumping out almost twice the amount of blood your heart is, supplying all his muscles and organs with that much more oxygen-rich blood. I want all of you to check what is your heart rate. It doesn't have to be accurate, so just keep your fingers on the radial pulse and count the number of beats for 30 seconds. Then multiply that by 2 and you have an approximate idea what your heart rate is. But remember, in a clinical practice, you should count for a whole minute. And make sure, while you are counting your heart rate, count truthfully. Because now you know that it is cool to have slower heart rate. You might forget to count a few beats here and there. Well, I'm assuming we don't have any professional athletes amongst us today. So we are going to study the details of cardiac cycle, assuming a duration of 0.8 seconds.
Now let's study the various phases of the cardiac cycle. Sir, could you please elaborate?
Yes, listen carefully. It might sound difficult, but once you understand, it is quite easy. As you know, heart is divided into 4 chambers, 2 atria and 2 ventricles. The right atrium is filled with deoxygenated blood from the superior and inferior vena cava, while the left atrium is filled with oxygenated blood from the pulmonary veins. Atria then pump this blood into the respective ventricles. The right ventricle pumps the blood into the lungs via pulmonary artery, like this, while the left ventricle pumps the blood into the arch of aorta, which supplies the rest of the body. Now, all these chambers contract and relax. One cycle of contraction and relaxation together make up one cardiac cycle. Now, it is important to know that atrial contraction and relaxation, which is called atrial cycle, is of the same duration as the ventricular contraction and relaxation or ventricular cycle. They are both 0.8 seconds each, but they occur in sync with each other. So the entire cardiac cycle is also 0.8 seconds long. This is a beautiful rhythm and synchrony that I find so fascinating. Right, now let us look at a graphical representation to understand all this. Now look at this. See, ventricular cycle and atrial cycle all going simultaneously. Now look at that properly. This is ventricular systole, ventricular diastole. Here it is atrial diastole and atrial systole here. See, both going simultaneously. Right. Now, you can notice that the ventricular systole and the atrial diastole started simultaneously. The ventricular systole went on up to here, but the atrial diastole went on up to this point. So, ventricular systole lasted for only 0.3 seconds, whereas atrial diastole lasted for 0.7 seconds. Right. On the other hand, atrial systole, which is this part, this lasted for only 0.1 seconds, whereas the ventricular systole lasted 3 times more for 0.3 seconds. And here you can see that the atrial systole and ventricular diastole end exactly together and the next cycle begins at this point. Right.
Sir, there is one thing I didn't understand. Why is it that the atrial and ventricular phases are different in length?
Well, that is a good question, Sneha. It shows that you are trying to understand rather than just memorize. Anyway, look. Let us look at both the systoles first. This is ventricular systole and this is atrial systole. When the atria contract, the ventricles are in a fully relaxed state. You can see here, the atria here contracting, where these ventricles are fully relaxed state. This is ventricular diastole. So that there is no resistance to the blood flow from atria into the ventricles. Hence, they can empty out their contents within just 0.1 seconds. But more important than that is that only 25% of the blood is pushed into the ventricles during atrial systole. That is here. Only 25%. Rest 75% of the blood has already been transferred to the ventricles during this period. Whereas the ventricles empty out their entire volume of blood only during systole. So it takes 3 times as much time. See, here it is 0.3 seconds. Here it is just 0.1 second. As I mentioned earlier, 75% of the ventricles are being filled. Hence, the atrial diastole typically lasts longer than ventricular diastole. You can see here, the ventricular diastole is 0.5 seconds, but atrial diastole is 0.7 seconds. This is longer.
Yes, sir, thank you. This really helps me understand the concept a lot better. Sir, could you also explain the atrial and ventricular cycles in further detail?
Definitely. Let us start with the easier one first, the atrial cycle. As I said earlier, the atrial cycle is divided into atrial systole, which lasts for 0.1 second, and the atrial diastole, which lasts for 0.7 seconds. You can see here. Let us look at a 3D animation of the atrial cycle. Now look here. See? Beautiful animation. The atria contracting and relaxing. So during diastole, you can see the right atrium being filled by the vena cava. You can see here. I'll help you. Right atrium. This is being filled by the blood from vena cava, both the sides, right? And the left atrium. Now this is being filled by the blood from the pulmonary circuit. In comparison, the atrial systole gets over very quickly. A very interesting aspect of the atrial systole is that when a healthy human body is at rest, it doesn't require the atrial systole at all. The human heart pumps 3-4 times as much blood as the body needs at rest. And since 3/4 of the blood ventricular filling occurs before the atrial systole, there is sufficient blood in the ventricles even without the atria contracting. The atrial failure will cause a problem only when the body requires additional blood. For example, when a person is exercising,
Oh, that is very interesting.
Yes. The human body is such a mechanism filled with so many fail-safe mechanisms in the place. Another significant thing is that you should remember that the atrial systole and ventricular systole never overlap. If they do, two things can happen. First, if the atrioventricular valves are open, then some of the blood from the ventricles will get pumped back into the atria and enough blood will not reach the aorta and the pulmonary arteries. And if the AV valves are fully or partially closed, then the pressure from either side of the valve can cause valvular damage. So, how does a human body ensure that this doesn't happen? To understand this, first we must understand how the atria and ventricles contract. This actually happens because the heart muscles are given an electric shock. Yes, that's correct. An electric shock. Yes, of course. Of course, it is not like the shocks that you see in the films when the people are being tortured or something, but it is an electrical current all the same. And this is generated by the SA or sinoatrial node. You can see here. See? SA node, AV node. So this action potential causes atrial depolarization, which causes the atria to contract. It then travels to AV or atrioventricular node, and then further through this bundle of His and this Purkinje fibers, causing the ventricles to contract. You can see here, or maybe I can show it on this picture again. The SA node here, from there it goes to AV node, which is here. From there into the bundle of His and left branch and right branch, and then Purkinje fibers all around, causing the contraction of the ventricles. Right. The time delay in the conduction of the impulse from the SA to the AV node ensures that the atria and ventriculus do not contract together. Marvelous, isn't it? We have already spoken about the atrial diastole. It is quite straightforward, lasting 0.7 seconds, where the atria are filled due to a continuous venous return. Is the atrial cycle clear now?
Yes, sir, perfectly.
Good. So then, let us move on to the ventricular cycle. This is a little complicated, so pay attention. The ventricular systole is further subdivided into 3 phases and the ventricular diastole into 5 phases. The ventricular systole lasts for 0.3 seconds and the diastole for 0.5 seconds. Let us look at an animation of the ventricular systole first, and then we will go on to the detailed explanation. Look at this. There are 3 phases of ventricular systole: the isovolumic contraction, the phase of maximum ejection, and the phase of reduced ejection. Now we will go into the details. First phase. The ventricular systole starts with the closure of AV valves. This happens at the end of the atrial systole. This brings about the first phase of isovolumic contraction. Sneha, do you know what is the meaning of isovolumic?
Yes, sir, I do. The etymology of this word is from the Greek language. In Greek, iso means equal. So isovolumic means the volume remains equal or constant.
Correct, correct. So it is isovolumic. Can see the word. Okay. So basically what happens is that the ventricles start contracting because the electrical potential has reached the AV node. But the semilunar valves as well as the AV valves are yet closed. So in spite of the ventricles contracting, there is nowhere for the blood to go. Hence the volume remains constant. But because of the contraction, the pressure inside the ventricle rises sharply. This pushes the AV valves, causing them to bulge into the atria. This phase lasts for 0.05 seconds. You can see it here, AV valve being pushed up into the atria. Immediately after this, the semilunar valves open, and because of the high pressure within the ventricles, there is a rapid outflow of the blood. This is the second phase of maximum ejection, and it lasts for 0.11 seconds. We can see it again. See, the semilunar valves open, blood starts going out of the ventricles, lasting for 0.11 seconds. Right. Next, third phase. Now, this outflow of the blood causes a drop in the pressure. But since the ventricles are still contracting, the blood continues to flow out of the ventricle. This is the third phase of ventricular systole, called the phase of reduced ejection. It lasts for 0.14 seconds. This is followed by ventricular diastole. We can see it again, the third phase of reduced ejection. See, the flow of the blood is now slow. Right. Now, the ventricular diastole, that is relaxation, is divided into 5 phases. They are protodiastole, isovolumic relaxation, first rapid filling phase, diastasis or reduced filling, and the second rapid filling phase. The ventricular diastole is divided into 5 phases. They are protodiastole, isovolumic relaxation, rapid filling phase, reduced filling phase, and second rapid filling phase. Now, if you remember, all these phases together last just for 0.5 seconds. But this is what it looks like in slow motion. Now let us look at them individually. This is phase 1. In protodiastole, the ventricles have just started relaxing. Due to this, intraventricular pressure inside starts dropping, and the blood that was pushed into the aorta and pulmonary arteries tries to come back into the ventricles. This pushes the semilunar valves shut. This first phase lasts 0.04 seconds. Right. This is followed by isovolumic relaxation. Just like in systole, during this phase, because the semilunar valves have closed and the AV valves are yet to open, the ventricles are relaxing as closed chambers, causing a steep drop in the pressure from 80 millimeters of mercury down to almost zero. This volume remains constant during this time. It lasts 0.08 seconds. Next comes the first rapid filling phase. It starts with AV valves opening, followed by a rapid gush of blood from the atria into the ventricles. You should remember that this gush of blood is entirely because of the pressure difference between the atria and the ventricles. The atria have not yet begun to contract. This phase lasts for 0.113 seconds. This is followed by diastasis or reduced filling. Since the pressure difference between the atria and ventricles has now reduced considerably, the rate of blood flow also reduces. Remember, the atria still haven't begun to contract. This is the longest phase of ventricular diastole, lasting 0.167 seconds. Finally, atrial systole starts, and this produces the last phase of ventricular diastole, the second rapid filling phase. 25% of the ventricular filling occurs during this phase, and this lasts for 0.1 second.
Sir, I'm sorry. I must tell you that I've always found this very difficult to remember.
Oh, that's perfectly all right, Sneha. It is difficult. It is a little tricky. Okay, let me ask you this. Did you understand what happens in each of these phases?
Yes, sir, I did.
Okay, in that case, if you had a way of remembering just the names of the phases, would it become easier?
Yes, definitely.
Then only remember, Punjab is for Dara Singh.
What?
I'll explain. Punjab, protodiastole, is isovolumic relaxation. For first rapid filling. D, diastasis. And S is second rapid filling phase. So Punjab is for Dara Singh. Does it make it easier?
Yeah, it does.
I'm glad.
So now we turn to the most challenging part of today's lecture, the pressure and volume changes in the heart and their correlation to each other. Over to you, Dr. Kulkarni.
Well, Sneha, I wouldn't use the word challenging, I would say rather interesting. You see, all these changes are very logical in nature, and their correlation also follows the same pattern. Once you understand them properly, I'm sure you will be able to explain them in your sleep also. The key is to understand the events that lead to these changes, which I'm sure all of you have understood quite well today. So, what we will do is, we will look at each of them individually first, along with the phases of the cardiac cycle, and then I will explain in further details. Let us start with changes in the intraventricular pressure.
During the isovolumic contraction phase of ventricular systole, there is a sharp rise in pressure because both the AV and semilunar valves are closed. During the maximum ejection phase, the force of contraction is stronger than the rate of outflow. Therefore, intraventricular pressure continues to rise for a brief period. Gradually, the rate of outflow and force of contraction equalize and the pressure evens out. In the reduced ejection phase, the force of contraction is lower than the rate of outflow. Hence, pressure gradually starts falling. With the onset of ventricular diastole, there is a sharp fall in ventricular pressure. A sudden closure of semilunar valves prevents blood from the aorta and pulmonary arteries regurgitating into the ventricles. In the protodiastolic period, pressure continues to fall. In the isovolumic relaxation phase, ventricles are actively relaxing as closed cavities, causing pressure to drop sharply. This continues until AV valves open. Even after they open, the pressure continues to fall for a while in spite of the blood flow from the atria because the ventricles are in a fully relaxed state. It is during diastasis that the pressure slowly begins to rise. During the last rapid filling phase, ventricular pressure shows a small but sudden rise. Then, ventricular systole repeats.
So how many of you understood the intraventricular pressure changes? Please raise your hands. Remember, it is okay if you didn't. So now let us go over this carefully. Since the pressure changes in the ventricles occur throughout the systole and diastole, we can't divide them into two parts. So we study them together. Now, before I explain the changes in relation to the phases, I want you to observe a few things in the graph. This x-axis shows the time duration, and this section of y-axis shows the pressure changes. When we study the volume changes, the y-axis will display the volume changes, right? This is the portion of the ventricular systole, and this is the diastole. The vertical lines denote the exact points where the systole ends. Now, if you notice, the pressure in the ventricles has already started dropping even before the systole is over. Secondly, look at this rise in the pressure. This is happening during diastole. So, what you need to understand is that just because the heart is contracting, it doesn't mean that the pressure will rise, and vice versa. If the heart is relaxing, it doesn't mean the pressure will be dropping. So, now let's begin. This is the point where the AV valves close. Look at this. This marks the beginning of the ventricular systole. Immediately, the pressure in the ventricles begin to rise sharply. This corresponds to the isovolumic contraction phase of the ventricular systole. Somewhere around this point, the semilunar valves open, but the ventricles are contracting with so much force that the pressure continues to rise. See, this is the rapid ejection phase of the ventricular systole. 2/3 of the ventricular blood is ejected during this phase. Towards the end of this phase, the rise in the pressure slows down. The highest point of this graph is where the rapid ejection phase is completed. Look here. At this highest point, 120 millimeters of mercury is the pressure. Now, the reduced ejection phase starts. This. Although the ventricles are still contracting, because the force of the contraction is now lower than the rate of the outflow, pressure continues to fall. Here. This point is the end of the ventricular systole. From here on, through Punjab, that is Punjab is for Dara Singh, Punjab or protodiastole, and is or isovolumic relaxation, the pressure is falling. Here. It remains steady through 4 in that mnemonic, or the first rapid filling phase, and Dara or diastasis. At this point here, and the atrial systole starts. And you can see a rise in the pressure during the Singh or the second rapid filling phase here. Okay? the AV valves then close and the cycle is repeated. Now, is it clear? Good. Don't worry if you think you won't remember it once the lecture is over. I'm sure with just one quick revision, it will all come back to you. Now, let's look at the intra-aortic pressure. Just like we did with the intraventricular pressure, I want you to have a look at the animated graph, and then we will discuss it in details. Since the intra-aortic pressure is entirely dependent on intraventricular pressure, I will also show you a correlation between the two.
In normal individuals, intra-aortic pressure is 80 millimeters of mercury during ventricular diastole. It starts rising when the semilunar valves open and goes up to 120 millimeters of mercury, rising parallel to intraventricular pressure during ventricular systole.
This is much simpler, isn't it? There are just a few things you need to observe carefully. Look at this tiny section here between the beginning of the ventricular systole and opening of the aortic semilunar valves here. Remember, the valves between the right ventricle and the pulmonary artery, as well as the left ventricle and the aorta, are called semilunar valves. The latter is also called aortic valve, so don't get confused. Right? This is the isovolumic contraction phase of the ventricle. This. So the pressure in the ventricles is rising, but the intra-aortic pressure is not, because the semilunar valves are still shut. As soon as they open at this point, the pressure in the aorta rises and falls just like it does in the ventricles, all the way up to the end of the ventricular systole. Notice this little precipice here. Sneha, can you tell me why this happens?
Yes, sir, I can.
Yeah.
This corresponds to the first or the protodiastolic phase of the ventricular diastole. The pressure rises because there is a backflow of blood in the aorta towards the ventricle, which causes the aortic valve to shut.
You are absolutely correct. At this point here, the aortic valve closes, and because there is no more flow of blood into the aorta, the pressure starts dropping. It continues to drop all the way till the aortic valves open after the isovolumic contraction phase of the ventricular systole.
Okay.
And now, we will move on to the last of the pressure changes, which are those in the intra-atrial pressure.
During atrial systole, there is an increase in the intra-atrial pressure. During the later part of atrial systole, the intra-atrial pressure falls because of relaxation of some atrial fibers. During ventricular systole, atria relax, but a steep rise in pressure is seen because of the bulging of AV valves into atrial cavity during isovolumic contraction phase of the ventricles. The semilunar valves now open and pressure in the atria falls as the ventricles go into the maximum ejection phase. During ventricular diastole, initially there is an increase in intra-atrial pressure because the AV valves are closed during the isovolumic relaxation phase of the ventricles, causing an accumulation of blood in the atria. This rise slowly continues until AV valves open. The pressure then starts to fall and continues till middle of ventricular diastole.
Now let me explain this to you in details. As you will have noticed in this graph, the intra-atrial pressure is very low compared to that in the ventricles. This is because the force of the ventricular contraction is much stronger than that in the atria. Let us start with the atrial systole here. It starts at this point. You can see a rise in the intra-atrial pressure here, accompanied by a similar rise in the intraventricular pressure. But this rise is confined only to the first half of the atrial systole. Midway through, some atrial fibers start relaxing and there is a fall in the pressure. Remember that the atrial systole lasts for just 0.1 second. At the end of the atrial systole, the AV valves close and the ventricles start contracting. But in the first phase of ventricular systole, which is isovolumic contraction phase, the ventricles are contracting as closed chambers, pushing the AV valves into the atrium. You can see the sharp rise in the intra-atrial pressure because of this. Compare this rise in pressure caused just by the bulging of AV valves. See here? Into the atria. The AV valves bulge into the atria with the rise caused by the atria contracting themselves. Here. This gives a good idea about the force of the ventricular contraction. At the peak of this rise, the semilunar valves open. Remember, the aortic is also a semilunar valve, and the outflow of blood from the ventricles causes a drop in the intraatrial pressure. Now, the pressure in the atria starts rising slowly. Look here. Slowly due to an accumulation of blood from the vena cava. This continues till halfway through the atrial diastole. At this point, the AV valves open here, and pressure suddenly drops, hovering just around 0 millimeters of mercury till the beginning of the atrial systole here. Yeah, I suppose the changes in the intraatrial pressure are quite clear to you now?
Yes, sir. They definitely are.
Good, good. Now, let's move on to the last section in the pressure volume changes, and that is the intraventricular volume. It is quite simple. I'm sure all of you have understood the ventricular systole and diastole quite well by now, so I think you would be able to understand this quite easily. Like we did with the pressure changes, we'll have a look at the animated graph first, and then I'll explain it again. Look at this. Right. So let's begin with the ventricular systole. At the beginning of the ventricular systole, the volume is maximum. See? Here. It is maximum. In the isovolumic contraction phase, the intraventricular volume stays the same because both the AV and semilunar valves are closed. See, it's remaining same. In the rapid ejection phase, the semilunar valves open and the volume drops rapidly. Look here, the drop in the volume. It slows down during the reduced ejection phase, continuing to drop till it reaches the minimum volume. See, this is the minimum volume. During ventricular diastole, the volume stays the same during the protodiastolic and isovolumic relaxation phase because again both the AV and semilunar valves are shut. It rises sharply once the AV valves open. This is the first rapid filling phase here. First rapid filling phase. The rise in the volume slows down towards the end of the first rapid filling phase. It stays almost constant during diastasis. See, it is remaining constant during the diastasis. And then it rises sharply during the second rapid filling phase because of the atrial systole. This is atrial systole and volume getting increased. Right. The end diastolic volume or the volume in the ventricles just before the start of the systole is often used synonymously with preload. Within physiological limits, the amount of blood in the ventricles at the end of the diastole is directly proportional to the force of the ventricular contraction and consequently the stroke volume. This is called Frank-Starling law. It's always good to have some little extra information, right? The normal end diastolic volume in the left ventricles is 120 milliliters on an average. In the right ventricles, it ranges from 100 to 160. See? Here. Right. So now, what's the next topic of the discussion?
So, could we discuss the electrical changes that occur during a cardiac cycle?
Sure. The electrocardiogram or ECG is probably the most widely used medical diagnostics in the film and television. Even my 2-year-old daughter knows that when the ECG shows a flat line, the patient is dead. But there is a lot more to the ECG than this flat and non-flat line. Not only is it useful in diagnosing heart attacks that are in progress or have happened in the past, but it is also useful in detecting many other cardiac conditions. The conditions like coronary heart disease, cardiac arrhythmias, cardiomyopathy, heart failure, congenital heart diseases, amongst many others. But for that, we need to understand what all these squiggly lines mean. The P wave, now look at here, the ECG is now unfolding. Yeah, right here. The P wave and the PR interval signify atrial depolarization. Look here. This coincides with the atrial systole contraction. The QRS complex signifies ventricular depolarization, and this coincides with isovolumic contraction. You can see the coincidence from this graph. You can see. The ST segment coincides with rapid ventricular ejection, and the T wave with ventricular repolarization and reduced ventricular ejection. You can see clearly in this graph the association of ECG with the other cardiac cycle changes. At this stage, this much information is sufficient for you.
Thank you, sir. Now the only topic left is the heart sounds.
Ah, that lub dub. Well, actually there are 4 heart sounds. We usually refer to just first 2 because in normal individuals, they are the only ones that are heard with a stethoscope. We require a phonocardiogram, an instrument called phonocardiogram, to listen to the 3rd and 4th heart sound. These sounds are caused because of 2 reasons. Vibration of the leaves of the valves during closure and turbulent flow of the blood from the atria into the ventricles. As you can imagine, listening to the turbulent blood flow is not possible even with best of the stethoscopes, and that is why we require a phonocardiogram. The first heart sound is caused by the sudden closure of AV valves, and it occurs at the onset of the ventricular systole. It is dull and prolonged like the word lub. It lasts for 0.1 to 0.17 seconds. The second heart sound is caused by the sudden closure of the semilunar valves. You can see here, semilunar valves. It occurs at the onset of the ventricular diastole. It is sharp and short like word dup. It lasts for 0.1 to 0.14 seconds. Now third heart sound. This sound coincides with the beginning of the ventricular filling. It lasts for 0.04 seconds and is caused by the sudden onset of the blood flow from the atria into the ventricles. And the fourth heart sound is due to the atrial systole. It is caused by the last rapid filling phase of the ventricles, which is brought on by the atrial systole.
This brings us to the last section of this lecture, the applied aspects of the cardiac cycle.
Yes, the applied aspects. As I mentioned earlier, the third and fourth heart sounds are normally not heard with a stethoscope. the third heart sound being heard on auscultation suggests an overloaded heart, such as what is seen in congestive cardiac failure, where ventricular valves are disproportionately stretched. Another clinically significant point is to remember is that if the AV valves are narrowed due to certain diseases like rheumatic fever, the atrial contractions play a much more important role in ventricular filling than in the normal heart.
Thank you so much for a wonderful lecture, Dr. Kulkarni. Now that we have learned the various aspects of a cardiac cycle, could you tell us what kind of questions a student should expect in the examination?
Well, in the exams, the typical long answer question is, define the cardiac cycle and describe the pressure volume changes in it. And your answer must contain the definition and the duration of the cardiac cycle, phases of the cardiac cycle, systole and diastole, then atrial events, systole, diastole, with individual parts, then ventricular events, systole, diastole with individual parts, and a diagram depicting the pressure and volume changes. You remember that diagram with vertical lines?
Yes.
Figure should appear in your exam.
Okay.
And typical short answer questions are, enumerate the difference between the first and the second heart sound. For this question, your answer should contain the differences based on the nature, pitch, duration, and frequency. Another short answer question could be, describe the pressure volume changes during a cardiac cycle. And here, your answer should have the diagram depicting the heart functioning as per the pressure and volume curves showing the phases of systole and diastole and the correlation between the pressure and volume changes.
Okay.
Let us assess how much have you understood in this chapter. I'm going to present a few MCQs, that is multiple choice questions to you. The first is, the average duration of cardiac cycle at rest in an adult is, and the options are 0.4, 0.6, 0.8, and 1.
0.8.
Correct. The second, the cause of the third heart sound is, the options are closure of AV valves, rapid inflow of blood into the ventricles, closure of the semilunar valves, or atrial systole.
Rapid flow of blood into the ventricles.
Correct.
Let us now begin the question and answer session. Please use the raise your hand option to ask questions. To summarize, in today's lecture, we learnt the definition of cardiac cycle, the phases of a cardiac cycle, events occurring during a cardiac cycle, correlation between pressure and volume changes, and a couple of applied aspects. Thank you so much.